Hello and welcome. My name is Cheryl Shannara, and I'm here today to discuss a study of interventions to encourage smoking cessation in adults. This is for NSC 890. Smoking tobacco is a rising epidemic. Smoking accounts for approximately 30% of all cancer deaths, including 87% of all lung cancer deaths. Smoking leads to an increase in health problems, including heart disease, stroke, chronic bronchitis, and emphysema. Tobacco addiction is the most common addiction found in the United States. Healthy People 2020 did identify a goal to achieve by the year 2020 to reduce tobacco use by all adults. Smoking tobacco is the leading cause of preventable and premature death. In the state of Kentucky alone, healthcare costs attributed to smoking an estimated of $1.2 billion annually, creating an excessive tax burden for each resident of Kentucky. I did include in my PowerPoint a chart from the National Vital Statistics record. It shows that 443,000 deaths in the United States each year are attributed to tobacco use, and it breaks that down a little bit farther into each disease that causes that. It's really interesting if you want to take a look at that when you get a chance. The intervention that I proposed to you was motivational interviewing. It was originally developed by William Miller for his work with problem drinkers or alcoholics. Motivational interviewing is a counseling style design to help clients build commitment and to reach a decision to change. Motivational interviewing does show that behavioral change, including smoking cessation, is particularly difficult for some patients. Motivational interviewing is an evidence-based method that has been expansively investigated to assist patients to overcome their tobacco addiction. Miller did state that motivational interviewing assists the individual in changing his or her perception of consequences that ultimately change behavior. I looked at two separate studies. The first one by Muick et al. Was a motivational interviewing, a smoking cessation strategy with nurses, an exploratory randomized controlled trial. That is how this study was designed, an exploratory quantitative randomized controlled trial. The purpose of the study was to test the efficacy, accessibility, and feasibility of motivational interviewing on smoking cessation on working RNs. The sample size was 30 RN smokers in a large teaching hospital in northern Spain, and it was a two-group parallel experimental design. The first group was an interventional group receiving motivational interviewing on smoking cessation for 4 sessions. The control group was what we identified as standard care, receiving only brief advice. The study did show it was a level 2 hierarchy of evidence because it was a randomized controlled trial. It did show that motivational interviewing as an intervention in RN significantly reduced smoking in that population. The study did, however, call for a larger randomized controlled trial and to consider more structure in the motivational interviewing sessions. The second study that I looked at was interventional study for smoking cessation in college Spanish students, a pragmatic randomized controlled trial. The design was a single-blind, pragmatic, quantitative randomized controlled trial. The purpose of this study was the same, to test the efficacy, acceptability, and feasibility of a motivational interviewing on smoking cessation on college students age 18 to 24 in Spain. The size was a little bit larger, with 255 college students age 18 to 24 attending the University of Navarra, Spain. This group study was set up with 2 groups, single-blind experimental design. The first group was the interventional group, which received motivational interviewing for smoking cessation for 50 minutes on 5 sessions. The control group did only receive standard or brief care or brief advice. This study did also have a level 2 hierarchy of evidence. It did, however, have auto-selection bias and could have been contaminated between the groups because the study participants did know the aim of the design. The results, however, were good, and they showed that motivational interviewing versus standard care does yield a modest but significant increase in quitting. And I did use this study to base my environmental for change that I chose for college students. College students are a higher percentage of smoking than other age groups. Approximately 13%, or 13 out of every adults age 18 to 24 are identified as smokers. I used Eastern Kentucky University's Health Service Building as a proper environment to conduct this intervention. It needs to be conducted in an outpatient primary care setting. The mission for this health services is to provide our students with the best quality care with a caring and compassionate environment while providing the education and tools needed to make individuals choices that promote health, wellness, and to enrich for the rest of their lives. And I felt that coincided well with this interventional technique. When I looked at the evidence and synthesized the evidence of my research, it did show that smoking is a local, state, and national epidemic. The studies did show that motivational interviewing was an effective intervention to decrease tobacco use by mean cigarettes per day and to also assist in abstinence in the overall percentage of study participants when compared to standard care. The data did show me that clinician-patient interaction influenced behavioral change, and when given the tools to help motivate patients to change health behaviors, APRNs become more effective. When patients arrive at an action plan that fit within their personal goals and values, change is most likely. This can be used in nursing practice because the relevant problem that can be addressed in primary care, and the APRN could oversee, implement motivational interviewing, monitor compliance, and ensure proper follow-up care. The ultimate goal of smoking cessation is to obtain a healthy lifestyle and to prevent illnesses. APRNs are in the perfect setting to educate and implement plans of care in order to reduce burden of tobacco-related addiction, disease, and mortality, thereby improving the health and well-being of all adults locally and nationally. I concluded with my references that you can refer to. Thank you, and have a nice day. I included my email address to email me if you have any questions or concerns.